This presentation is for parents and carers to learn more about the senses and how sensory difficulties affect children with additional needs. We use our senses all the time. There are 7 of them: sight, sound, smell, touch, taste, balance and body awareness. We use our senses for everything. Whilst most of us are automatically able to use our senses to manage our environment, some children experience what we call sensory or sensory processing difficulties. When children experience difficulties, we might describe them as either being hypersensitive or hyposensitive. Hypersensitivity is when children are more sensitive to one of the senses. For example, a child might see lights a lot brighter or hear sounds a lot louder than others. Hyposensitivity is when children seek sensory activities out. For example, a child who is hyposensitive to sound might make loud noises as a way of stimulating their underactive sense. Children can be hypersensitive on some occasions and then hyposensitive on others. Senses can affect all areas of children's lives, including their emotional state and feelings. They affect children's everyday living, such as eating, sleeping, temperature, shopping. Senses can also affect children's learning, for example, being able to manage temperature, sounds and light in the classroom. The senses can often affect the lives of children's families and the people around them. Senses can also affect children's ability to concentrate on play activities, go out, manage social situations, attend appointments, for example, the dentist, hairdressing, medical appointments, shopping, eating, sleeping, and even toileting. An arousal state is the state that a child is in when they are performing an action or in the moment. There are 4 states of arousal: under-aroused, shut down, sensory seeking, and over-aroused. Under-aroused children may appear to be not looking, not listening, they may fall asleep, or they may fidget to stay awake. They need activities to wake up their brains. Children who are shut down can be hypersensitive, for example, to light, to touch, or sound. They need activities to calm their brains. Children who are sensory seeking may constantly run, climb, fidget, or jump. They need activities that offer sensory input like a trampoline or a wobble cushion. Children who are over-aroused find it hard to filter out distractions. They can be quicker to get upset and distressed, and they find changes to routine difficult. Being aware of arousal states helps us know which strategies to use to support children. All the senses are important and have an impact on children. Senses such as vision or hearing are limited to certain parts of the body. Some of them are more complex to understand than others. Touch is one of them. Touch allows children to feel the world around them. It plays an important role in everything they do at home or during leisure and playtime. Some of the jobs of the tactile touch system are to let children know about threats and boundaries. It can tell them if they are feeling pain or if they need to fight or flight. Touch allows children to sense the temperature of a place, a room, or an object. Touch is not limited to certain parts of the body. It exists all over, including in the mouth. Touch allows children to touch others and explore objects, and it can tell us about the consistency and texture of food. For example, if our food is hard or if it's soft. Children may be hypersensitive to touch. For example, clothing or temperatures may be uncomfortable. Children who are hyposensitive to touch may not notice if their clothing is on back to front, or they may not notice if they have hurt themselves. Children who are hypersensitive to touch and taste may find it hard to eat specific textures. They might gag or be fearful of dinner. Children who are hyposensitive to touch and taste, on the other hand, may constantly mouth things. They might put things in their mouth, or they might prefer extreme tasting food, for example, hot or lemon flavoured foods. There are lots of strategies to help children with touch, including monitoring children's responses to food and clothing and then responding appropriately. This might be buying larger clothing, washing clothes a few times to allow them to soften before children wear them, removing labels, introducing new clothes and ensuring others around you know that your child has a genuine need in this area. Strategies to support around taste include introducing new foods slowly, one at a time, staying calm at meal times, allowing children to look, feel, explore foods and to take note of the times when children respond better to foods. For example, do they like their food better when it's at room temperature? Children with difficulties in the area of vision may stare at spinning objects for long periods of time and appear lost in the moment. They might spin their own bodies to gain increased visual feedback. They might turn to face in the opposite direction when you're talking to them so they can listen and not be overly distracted. They might give no eye contact or look beyond your face when talking to you. They might avoid light, or they might tilt their head when looking at a screen or paper to reduce the glare. Strategies to support children with difficulties related to the visual system include avoiding fluorescent lights, having lower wattage lighting, avoiding light at all in some cases, using blinds or curtains and introducing natural daylight, reducing visual distractions, including reducing pictures and posters on the walls in the home. Children with difficulties related to sound might be hypersensitive and easily distracted by sounds that we do not normally notice, for example, humming lights, clocks or the fridge. They might be fearful of flushing toilets, vacuum cleaners, babies crying. They might be upset by loud noises. They might refuse and become distressed when they go to the cinema, shopping centre or supermarket. Hyposensitive children might fail to respond to verbal prompts or cues. For example, they might ignore their name when it's called. They might appear to be really loud, humming, singing and continually making noise. They might talk themselves through a task without being aware that this is distracting for others. They might appear to have missed key points in conversation, or they may be oblivious to sounds that others might react to, for example, having the television on full blast. Strategies that help children with difficulties related to sound include having carpeted areas in the house or shoes off in the house where there are wooden flooring. It may help to warn children when they will be going to noisier places and to provide them with a quieter space at busy family events. Children with difficulties with smell may be hypersensitive and hyposensitive. Hypersensitive children might report that children or people whiff if they're wearing strong perfume or if they've eaten strong smelling foods. They might notice smells that others do not ordinarily notice and they might react strongly to them. Hypersensitive children might refuse to eat certain foods because of their smell. They might refuse to visit certain places because of the smell, for example, farms or zoos or toilets. They might become upset when certain foods are cooked in the home or within school. Hyposensitive children may smell everything they touch to become comfortable with an object or a thing. This can include touching classmates and staff. They may not notice really horrible smells and they might actually seek out strong smelling things. We can help children who experience difficulties with smell by reducing the smells around them. For example, the perfumes or body lotions we, the adults, use. We can use extractor fans when we cook and use non-perfumed air fresheners. We can also think about smells outside the home, so keeping windows closed, for example, when the grass is being cut. The vestibular system is responsible for movement. It provides us with our sense of balance. It affects gross, so large body movements such as walking, sitting and running. It affects fine motor, so small body movements such as mark making, using forks and spoons, tying shoelaces or buttoning a shirt. Movement can be calming or stimulating. An example of when the movement, the vestibular system, is affected is when we go on a fair ride. Some people will feel sick, so hypersensitive, or some people will crave more of that moment, hyposensitive. Children with difficulties in this area may be hypersensitive and present as being clumsy or having poor balance, often tripping or falling. They might be fearful, cautious or hesitant when it comes to taking risks. They may be hyposensitive, so finding every opportunity to fall without regard for their own safety or others. They might have trouble staying seated. They might become easily disoriented. For example, falling, but actually enjoying and seeking activities out that enable these opportunities. They might be thrill seekers, jumping from high places or climbing and having no sense of danger. Strategies to help children who are hypersensitive to movement include limiting unnecessary movement, slowly introducing them to movement and supporting them during balancing times. Children who are hyposensitive need frequent movement breaks and chances to ride their bikes, to trampoline, and have alternative access to seating such as ball chairs and wobble cushions. They can also benefit from weighted equipment like weighted blankets, waistcoats and lap pads, all of which occupational therapists can help with. To conclude, when children's sensory needs are not met, they might feel anxious, overwhelmed, or display behaviour that might appear challenging. They use these behaviours to regulate and calm themselves. Some children need additional activities and sensory input. Adults can replace some of the challenging behaviours with more appropriate or acceptable activities and behaviours. We might have to do this regularly throughout the day. This keeps children's senses and arousal levels at the right level. When this happens, children can manage daily activities better and focus well on the things that they need to. For example, when eating out or being out in the community, they can also learn better.